Yeah, my question has to do with when people are low.
Right.
It seems more intuitive, and I've heard more about when they're high, but when they really are low, or at least when it appears low, and I've done some cortisol tests where
Mhm.
three of the four at least come back
Really
below
low.
the region that's acceptable. What do you tend to do? What do you suggest for
Well,
those?
I would tell you two things. One, well, three things. One, you can give adaptogens, ginseng, rhodiola, cordyceps. We use Taylor and B formulations of Adrenacare. So you can use glandular or botanical adaptogens. That's one. Two, licorice will increase cortisol. It'll decrease the breakdown of cortisol, but I don't use that very much. But if you really have low cortisol and the patient's very symptomatic, very fatigued, I would suggest, if you haven't already read it, read Safe Uses of Cortisol by Dr. Jeffries. Have you ever read that book?
No, I haven't.
Okay, if Safe Uses of Cortisol, let me see if I can find it. I'm going to put that up. That is a book, if you want to deal with cortisol. Dr. Jeffries was a Safe Uses of Cortisol, William Jeffries. He was an endocrinologist uh, at Wayne State, I think. He's now passed, I think. Um, but when cortisol is very low, I actually use cortisol. Yeah, this is the book. I would suggest you read it. It will allow you to get over your fear of using cortisol. When I speak to docs, I say, when I say cortisol, docs hear prednisone, and so they get frightened. But cortisol is 1/4 as potent as prednisone. And when you're thinking about hormone replacement, cortisol is a hormone that you need. You just don't need too much of it, and you don't need too little of it. Safe uses of cortisol will explain how you can use 20 milligrams of cortisol divided up over the course of the day. And I usually will try and mimic the cortisol curve where I give the most amount in the morning, because that's when it should be the highest. So you can give 10 milligrams there, 5 milligrams at noon, because cortisol has about a 4-hour half-life. And you use the cortisol while you are giving the adaptogens and the B vitamins and the vitamin C to help the adrenal gland recover and to start making cortisol on its own again. So I use cortisol, usually like that 10, 5, and then maybe 2.5 in the evening. I'll use that for the first 2 or 3 months, and the patients will feel better usually that first week. And then I'm giving the adaptogens, I'm giving vitamin B, the B vitamins, I'm giving vitamin C, and over the course of the next 2 to 3 months, the adrenal gland begins to work again. Then you can taper them off with the cortisol. Because a lot of times if you have a patient with low cortisol, they aren't really motivated enough to do what you ask them to do for 2 to 3 months before they feel better. So I'd say cortisol is the short-term solution. Correcting and increasing the function of the adrenal gland is the long-term solution. So I use that when it's very low. If it's not that low, then you can use the adaptogens and whatever, and they'll start to feel better slowly. But a lot of people are afraid of cortisol. When you read that book, you'll understand how necessary it is to have a normal cortisol curve. You don't want to have super physiologic doses that 40 milligrams of prednisone would give you, but you do want the normal cortisol curve. And if you have a patient severely low in cortisol and you give them cortisol, they will hug your neck at how much better they feel once they are on even just a little bit of cortisol. It gives them energy. It really is something you need to know about and not be afraid to use it when it's appropriate.
Thank you. And those people that you've done it with, what percent do you have difficulty weaning at 3 or 4 or 6 months?
See, you know what? You don't, because, and let me tell you, and you probably could go without weaning it, but it sounds better medical legally to tell you to wean it. See, the reason why you have to wean a person off of 40 milligrams of prednisone, because that high dose suppresses all adrenal function. And so in order to get the adrenal gland to start making cortisol again, you have to wean them off, because if you just stop them cold turkey, they would have Addisonian type symptoms, because they wouldn't be making any cortisol. Okay, so I'm not giving a high enough dose to suppress the adrenal gland. I'm
Mm-hmm.
just augmenting the natural output of the adrenal gland. So I never suppress it. So I'm just giving enough for the body to be able to use it and to feel normal. And then the adrenal gland is going to kick in and it's going to provide the rest. So I don't really have any trouble with weaning them off because I haven't suppressed the adrenal function. Okay,
Cool.
so
Mm-hmm.
and then what I would do to wean them off. So let's say I got them on 10 in the morning, 5 in the afternoon, and maybe 2.5 at night. So what we would do is just half it. I give them 5 in the morning, give them 2.5, and then maybe I cut away the evening dose. And I would do that for about I would do it 2 weeks, cut it in half again, 2 weeks, and then usually after that they're fine. So you're not going to. That's why I say when I say cortisol, you think prednisone. See, 20 milligrams of cortisol is really like 5 milligrams of prednisone because it's 1/4 as potent.
Mm-hmm.
When you get to 5 milligrams of prednisone, you're off the wean, right?
Mm-hmm.
You see, so that's the total amount I'm really giving. So I really don't have to deal with those issues because if I didn't have doctors who didn't understand it and would worry about it, I wouldn't even talk about weaning because you probably could stop them. But you're not going to have any trouble getting them off because you haven't suppressed the adrenal function.
Mm-hmm.
And I'll tell you, my first guinea pig, which is very common, my first guinea pig at using cortisol was my wife. And let me tell you, she was a person who had trouble getting up in the morning, was always sick. If the kids were sick for 2 days, she was sick for 2 weeks. We tested her cortisol. It was extremely low in the morning, gave her 10 milligrams of cortisol while we were giving her adrenal supplements. She was a different person within a week. So I'm telling you from personal experience and from clinical experience, a person who's low in cortisol, and now again, I never give cortisol unless I have a salivary test that says no doubt about it, it is low. It is extremely low. If it's mildly low, I'm just going to use adaptogens and the vitamin C and the B vitamins. So this is not your first option. But the people who really have adrenal fatigue, again, a lot of them, if you tell them it's going to take them 3 months to get better, they're not interested.
Mm-hmm.
Or they may say they're interested, but they're not going to do it. Okay?
Thank you.